Welcome back to our YouTube page. I'm Faye D'Souza. Thank you for joining us. I know it's been a bit of a break. I've taken a break. Amita and the team have been here giving you the news, but I'm back with shows now where we discuss what is going on in the country. We discuss news that's relevant to us. Now, the story that we're going to discuss right now is something that shocked a whole bunch of parents, particularly. I can tell you that it's any parent's worst nightmare. Now, this is the story that came up. On Wednesday, the World Health Organization issued a global alert against 4 children's cough syrups manufactured in India, which was connected to or linked to the deaths of 66 children in the country of Gambia between July, August, and September. Now, the cough syrups are said to have caused acute kidney failure and then led to the deaths of these children. Now, the products are promethazine oral solution, coffee melon baby cough syrup, Make Cough baby cough syrup, and Magrip N cold syrup, manufactured by the Indian company Maiden Pharmaceuticals, which failed to provide proper guarantees about the safety of these cough syrups. This is what the WHO said. Now, I'm reading out of a report in the BBC that came out just a few hours ago that said the police are now investigating the deaths of these 66 children linked to this cough syrup. They've asked for the importers to be called in for questioning, and the president of the country has said no stone will be left unturned. Now, parents have told the BBC how after giving the children the cough syrup, the small children weren't able to pass urine anymore and their condition worsened, and they eventually lost their lives. Any effort to save their life after that in hospital was completely fruitless. Now, in a comment to ANI, the company in question, Maiden, has said it followed, and I quote, Indian health protocols and is cooperating with the investigation. Gambian health office officials and Red Cross workers are now going door to door in that country, collecting these bottles of cough syrup to make sure no more children actually take these cough syrups. So far, they have collected 16,000 products of these syrups that have been taken away for destruction. Now, what do the syrups contain? That's a problem. A particular chemical called DEG, or dethenyl glycol, or ethynyl glycol, which is toxic to humans when consumed and can prove fatal. Apparently, this is what is used in antifreeze and in other lubricants and cosmetics and brake fluid. How it wound up in that syrup and why it stayed in that syrup in larger than safe number, we don't know yet, and we're going to try and find out. India's reaction is that the Indian Pharmaceutical Export Promotion Council has suspended the license of this company. The Indian Health Ministry has said it will investigate the matter. The ministry has added that samples of the medicines have been sent for testing, and Haryana's Health Minister, Anil, has said the samples of this cough syrup manufactured by the firm has been sent to the laboratory in Kolkata for testing. Now, this also reminds us that in 2020, there were 11 children in Jammu's Udhampur district who also died because of a cough syrup called Cold Best, PC. Incidentally, it was the same chemical that was found in that cough syrup as well. So many questions about what this means for parents in India, and do Indian standards, in spite of Indian standards, are Indian standards strong enough? How is it that this terrible chemical that can definitely cause death winds up in cough syrup that we give to babies? To help me answer and understand all of these issues, I now have Murali Neelakantan, who joins us right now, principal lawyer, amicus, which basically means he advises company boards and senior management on legal and policy matters. He's specifically an expert when it comes to pharmaceutical law. Murali, good evening, and thank you for giving us your time. It is a pleasure to catch up with you after several months. I'm so glad you were free this evening. Explain to us, first of all, if you would be kind enough, what is DEG and how does it wind up in a cough syrup? If it sounds like poison to me. How does it wind up in a cough syrup that we give babies?
So the DEG itself is mixed with lots of other chemicals. So it has many uses, As you said, it's used in antifreeze, it's used in auto comps, it's used in lots of industrial products. We know that it is contaminating other glycol or glycerine, which adds volume to your cough syrup. So the cough syrup itself is in a big bottle. Not 100% of it contains the active ingredient. So we use fillers to make up the ingredient. So it's like your pill. You take a paracetamol pill, it has probably 500 milligrams of it. But you can't make something of 500 milligrams that is easy to use. So you fill it with lots of other things, so it becomes a pill that you can hold. Otherwise, 500 milligrams of paracetamol is almost impossible to hold. So those are fillers, those are excipients. They have many uses. One is to make up size and make it easy to actually take the pill. Another is easy for it to be stored. In this case, with cough syrups, you make up volume rather than having a very concentrated product. You make up volume with other things. You also use glycol to make it sweeter. So the active ingredient itself is going to be terribly difficult for babies or even adults to take. So what do? You add color, you add flavor, you add sweetness to it. Perfectly normal thing to do. The problem here is that all of those ingredients need to be certified for human use. So we have pharmaceutical grade products and we have industrial grade products. In an industrial grade product, this kind of an impurity doesn't really matter. It's cheaper than glycol, and therefore it's quite easy to mix it, and it does more or less the same thing in your car engine or in your antifreeze. Therefore, we have separate suppliers for industrial grade glycol, and we have separate suppliers for medical quality or medicine quality, drug quality for human consumption. Therefore, whoever is buying this as a raw material needs to check for all known impurities and toxins. So if I'm a manufacturer of a cough syrup, I will check every ingredient for known contaminants because we know what the testing process for these contaminants is. Now, how do we know that there is a testing process for these contaminants? We know it because we have what's called pharmacopoeia, which is a book which has testing guidelines for ingredients and known additives, contaminants, and toxins. It's only one page for DEG. So you can't say, oh my God, it's too complicated, we don't understand it. It's just one page, and it's explicitly written there what is the testing to be done for DEG. So every cough syrup manufacturer or other syrup manufacturers, when they get glycol, will do these tests before they start the manufacturing process. So it's not very difficult. It's been known for more than 50 years to kill people. And we know what the process is. There is a well-established process in India for testing for this toxin contaminant in glycol.
Then will you explain to me how it winds up in large quantities in syrups that we seem to have exported to Gambia and wound up killing 66 children?
So the most likely explanation, Faye, is that the manufacturer didn't do these tests. You need good equipment to do the test. This is a small scale industry, a tiny manufacturer. Now, I've only seen pictures in the media, but please, I wouldn't buy anything from a factory that looked like that. I mean, I wouldn't buy a metal grill from that factory, leave alone cough syrup. Now, do you expect that a factory that looks like this will have equipment that is worth something to test all ingredients, to follow a good process, a good manufacturing process, test during the process, test at the end of the process, document all of this, and check against the standard to be sure that it meets the standards before it's sent out? Now, This is fairly common. It's called good manufacturing practice. It is the law that you have to do all of this. But I suspect that we had many chances to catch this, to make sure it didn't happen. From the time the raw materials came to the plant till the time the actual final product left the plant, we had several opportunities to find this contaminant, look for it, and ensure that nothing that is being sold has this contaminant. It seems that there have been many failures along the way.
So obviously
Nobody tested.
there will be now investigations into this particular manufacturer and exporter, both by the Gambian authorities. We understand the parents of the children whose lives have been lost are also now initiating action themselves. Plus, one hopes the Indian government will look into it. But they will look into one specific manufacturer. In the meantime, India is the largest exporter of generic drugs in the world, including cough syrup being that generic drug. My question now, also as a parent, is this. I don't know what the factory looks like. I assume, when I buy medication, I assume the factory in which it is made is completely white and everybody's wearing hairnets and gloves and it's completely clean, because that in my mind is what a pharmaceutical factory should look like, that all the checks and balances are being done before we give something to our children. Even if, let's assume, our pediatricians and our doctors are prescribing responsibly after making some checks themselves, spurious drugs, fake drugs, drugs that look like the cough syrups but are not really from properly tested places. How on earth are we going to know? I mean, the scary part about this is that cough syrup can kill your child, which we don't actually assume that the cough syrup could kill your child. Now that we know that that is true, how could we possibly be able to tell the difference?
Sadly, we won't. And that's exactly why the regulator needs to do its job. We have thousands, tens of thousands of manufacturers in this country. Most of them will get through their lifetimes without ever having been inspected for anything. So we're trusting that the manufacturer has a conscience, cares about people's lives, and will produce a great product. Now, we know that that's not the case. So there is a risk, not just with this plant, but to everybody else that same supplier has sold this product, the raw material. And that could be thousands of companies buying glycol. So it could be in any other brand as well. So for the Indian government to say, hey, this was only exported, all our kids are safe, is just a lie, because our kids are not safe. They weren't safe a few months ago in J&K. They weren't safe a few years ago when Cold Best or whatever it was called was consumed and kids died. So we know for a fact, at least for 50 years, that cough syrups with this contaminant and toxin kill. That's why we have standards and we have testing protocols. Now, there is nobody to police whether or not these protocols have been followed. So it's bad news.
That is the scariest thing I have ever heard. Meena Isaac says, aren't there audits right now and licensing requirements to keep manufacturers on their toes? What are the mechanisms to keep an eye on these factories? You've just told us that, but actually, while the Indian government may be saying, okay, we're looking into this one manufacturer, they're also going to have to, at this point, reassure the world, because India exports to the world generic drugs to the world, and it's not about checking on a manufacturer. There needs to be regular checks on all manufacturers.
Uh, I, I don't think the Indian government is in any position to give that assurance. If it is not checking manufacturers killing its own people, why do you think it will check manufacturers killing African babies?
So, Murali, here's my question. There is an Indian Pharmaceutical Export Promotion Council, which has
Yes.
apparently suspended the license or the membership of this maiden pharmaceutical. It's not a license, I beg your pardon. It's a membership. What this
Yeah.
suspension means is that, incentives of up to 2 crore rupees that the company was enjoying up till now, they will not enjoy. So it's a penalty of about 2 crore rupees to this company. But is there a license that these
No,
companies need have in order to manufacture drugs in their backyard, in their sheds?
They have a license from the state drug regulator, which is
Lovely.
granted for the asking. So there is no check when that happens. You just ask for a license and you get one. You provide copy pasted version of what you think the manufacturing standard should be. Nobody reads it. You submit a big fat file to the local state FDA, and they will approve and license your manufacture. So you can manufacture virtually anything you like, irrespective of what you say in the paperwork, because nobody's going to actually come and check and say, here's what you said, show me you're actually doing what you're saying. If we don't do it for Indian products, we're not going to be doing it for foreign products. So let's not be under this misapprehension that we're going to have export quality products because the Indian government is going to check what is being exported. If it is not checking what is being sold in the Indian market to its own people, it's extremely unlikely, and I know it does not happen, that they will check products for export. The regulators like the US FDA or the European Medicines Agency will conduct inspections and audits of plants and products which are being exported to those countries, which is why you don't see as many of these cases in the Western world. You're likely to see them in India, you're likely to see them in the global South. You're not likely to see these kind of instances in the Western world. So we do have this very clear quality caste system where what goes to the United States and Western Europe is really good stuff. Also, what they do is because they don't trust Indian products, have an independent lab certify that product again. So, despite what you present as your own data and your own quality certification, they expect another independent lab to confirm all of those certificates and confirm the quality of it before it's allowed to get into the system. Also, you will realize that if there is anything that goes wrong, even very, very slightly, by the minutest of margins, which in most situations has no real impact, there will be an instant recall. Show me where in India there has ever been a recall of anything. So you have the Western world, which expects a quality standard, gets a quality standard, still doesn't trust it, has it certified by an independent lab, and makes sure that subsequently, if something is discovered, they go back and recall that whole product. There is also the situation where if that product actually causes any harm, the Indian manufacturer will be on the hook for it really, really badly. Finally, in the Western world, if a product or a manufacturer has problems in its plant unrelated to that product which is being sold, so let's assume that you sold some paracetamol in the United States, but that plant also makes ibuprofen, makes lots of other things. And if there's been a problem with any other batch in any other country, these regulators will expect that they will be immediately notified. Now, why is that relevant? We know that this manufacturer has had trouble in India, has had trouble in Vietnam, has had issues of manufacturing quality for a very long time. And yet, it seems to be able to happily go off and continue to sell all over the world.
So what you're saying right now is that India does not have adequate pharmaceutical standards by any yardstick. In fact, the only pharmaceutical standards that are followed are by the US FDA or the European drug regulators, because we want to be able to meet their standards in order to export to them. Uh, what is needed right now as Indian citizens to at least make sure that the drugs that are being sold to us meet certain standards? Can we demand better from our government? Is it likely that the government will heed to that demand?
We should be demanding it. I think some attempts were made, but who do you demand it to? If the government does not care about its own people, and we have had several deaths, and no one's gone to jail. Now, I looked up for the last 60 years, No executive of a pharmaceutical company has ever gone to jail for a spurious or contaminated or toxic medical product. So you have a standard, it's in the book, nobody follows it, people die, and there are no consequences. That's the Indian story.
What about the courts, Murali? Approaching, filing cases, going to the judiciary. We know that there's a long, drawn-out process in India, but has that ever resulted in change, or has that ever resulted in some punishment?
No, and that's exactly the problem that we hear that many cases have been filed by the drug regulator. So Parliament is told that we initiated 2,000 prosecutions in 1920 and a similar number the year before that. But as I said, in the last 60 years that I have looked, not one person has been sent to jail. So clearly, each of these prosecutions is so badly done, and I have examples where the complaint is so badly written that nothing really happens. The complaint is filed, the High Court says this is a rubbish complaint, quash it. Or the Supreme Court says, come on, there's nothing here to show there was any crime. So people have died, even where in a small number of cases complaints have been filed. The prosecution is completely crashed because it's so badly written. If you can't even write a complaint when people have died to explain why it is that somebody should be held responsible for it, it's very little courts can do, and they haven't been convicting anyone. The punishment is there. So the punishment for not just death, this is likely to cause death, is 10 years to life imprisonment. It's almost the same as murder. That's the punishment in the books. Yeah, I couldn't find one case.
In which that conviction had been dealt out.
Nothing at all. So we've got thousands of people who've died, uh, thousands of complaints have been filed. Not one of them has resulted in conviction. So nobody really cares. So the pharmaceutical companies don't care. Nothing's going to happen to them. So if they can sell something cheap, people die, bad luck. The alternative, if you look at it elsewhere in the world, is that people go to jail. They're fined millions and they go to jail, and it's done fairly promptly. So you don't have an issue elsewhere in the world because there is a law, it is enforced, people are careful, the regulator is really, really careful. And a scandal like this is just unacceptable to the political bosses there. Here, it just doesn't matter. You're talking about cough syrup, we have similar stories with every other product, Faye. We've got with basic saline, we've got with distilled water. I mean, distilled water, how bad can it be? Saline is just water with some salt in it. We've got contaminants there that have killed kids. So, we can't produce thanda pani. You're asking now for cough syrup to be safe.
Is there a way in which the Indian customer can find out what is US FDA certified and only buy that?
So here is the problem. Many of what we consume in India, most of it is not made by a US FDA certified plant. So pharmaceutical companies realize that if you're living in two different worlds, following two different processes with different sets of ingredients, different standards, it's best to do it in two different plants. So most of what you buy in India is from a plant that's unlikely to be US FDA approved, unlikely to follow that process. It's following an Indian standard and it's following an Indian process for the Indian market. It's not necessary that it's cheaper. It's just more profitable not to follow it. So you could get a very cheap paracetamol that's exported to the United States or Western Europe, and it costs, you could get 100 for less than $1. Okay. That's the export price. So it's very, very cheap. It's as cheap as what you could buy in the Indian market. But the standard at which it's produced is very, very different. Whereas the same product, when it's produced in a factory in India for the Indian market or for the African market or the LATAM market or the Southeast Asian market, doesn't use the same quality ingredients, doesn't get tested in the same way, doesn't follow the same process, and therefore you get very poor quality product. So there is a real problem with us in India saying we want export quality stuff, but not the stuff that goes to Gambia and the rest of the global south, but we want to see US FDA quality product. And we know for a fact that most of what we consume is not from a factory that produces a US FDA quality product. So even the major companies have a variety of plants. The major companies have now realized it's easier to contract manufacture the thing. So you could have a contract manufacturer in Rishikesh or Baddi or something making 10 different brands of cough syrup for 10 different companies, all produced from the same factory for the Indian market. So they've
You know,
realized that's another way of cutting cost.
I was going to ask you that, because what the other option, which I know a lot of Indians do when it comes to most things, like most food and drug items, is that you flip it around and you look at the company that's manufacturing it, and if it
Yes.
happens to be a large recognizable name, and within
Yeah.
pharmaceuticals there are a handful, maybe 5 names that we all recognize, and we're like, okay, I know this company, I know a Dr.
Yeah.
Reddy, I know a
Yeah.
Glaxo, I know these guys. They're big companies, they're public companies. This must be okay. But you're
Yeah.
saying that the contract manufacturer, and the contract manufacturer could be a shed in the hills somewhere
Yeah.
in Haryana who's not
Yeah.
being checked. But
Yeah.
isn't it the responsibility of these big listed pharmaceutical companies to constantly check what's coming from these smaller, contract manufacturers? Because we know this is how pharmaceuticals are made. Step 1, 2 will be made somewhere. The company in question will make step 3 and 4, which is package it and brand it and put it out. But aren't they responsible, or should they be held responsible for checking what they're getting from their contract manufacturers?
Uh, the answer is they should be responsible. But the truth is that nobody's going to hold them responsible because the regulator is not actually checking these products. And where is the paperwork to say all these tests have actually been conducted? This is well documented. A couple of years ago, we had this discussion on Catherine Eben's book, A Bottle of Lies. And she's an investigative reporter, very well recognized. And she's got pictures of these plants. She knows that there were issues where they just made up quality control certificates. They made up testing data. So even if you do get the paperwork, the product doesn't match the paperwork. So you could get paperwork from the contract manufacturer which said, I did all these tests. So the company is not, and the company also knows that these tests are never being conducted. So everybody is very happy at best by looking at some certificate and saying, did you do the test? They'll say, yes, here's a certificate. Everybody is happy, covered their backsides, and it stays that way. And hopes that nobody gets killed.
Right now we have someone who said, "Can you please put out the list of cough syrups so that we can avoid it?" Now, here's the thing: the names don't matter, do they? The name is
Exactly.
just a label on the bottle. It's what's in the bottle. Could all be manufactured by the same guy. Whatever you are buying could also be manufactured by the same guy under a
Yes.
different name. Is that correct? Mhm.
Yes. So the reason we can't tell you what is safe is two. One, we don't know where it's manufactured. Secondly, we don't know what the ingredients are, who the supplier of those raw materials is. So we're going further and further away. Even if you do identify the brand, if you do identify the plant, how do you identify who the supplier of the raw materials is and what the check is on that person and the product, the raw materials that are coming into this? How do we know they're checking it at the entry of the raw materials into the factory? Are they just looking at a certificate which says we've done the tests and it's all okay? Are they actually checking it themselves? So the US FDA, for example, requires the whole supply chain to be tested. So even if you have a supplier who's giving you a product with a certificate saying, I've done all these tests, it is necessary that the manufacturer, before it takes this into its factory, so there's a separate place for raw materials, they're kept there, they're checked again. So the raw materials checked before it comes into the factory, there's a separate holding area for raw materials. Separate one for active ingredients, separate one for excipients. So these are all designated areas separate from the manufacturing part of the factory. at that place, they will be held as if it's a quarantine until quality control says, yes, we've tested it, and yes, it's good for use. So that's the extent to which the Western world, the developed world, will
Hmm.
make sure that nothing goes wrong.
Here's the irony: India is the largest manufacturer of pharmaceutical drugs for that Western world, developed world. We also know that the US FDA regularly sends teams to India to
Yes,
audit the factories in which these drugs are made, which they then allow to be exported to their country. And a lot of times they put freezes, they stop it, they suspend
yes,
licenses till such time as
yes,
things are not up to scratch. In India, we know how to do it right because we do it
yeah,
for the US and for Europe. We don't do it for our own country because we don't have regulators enforcing these laws for our own country. So, as a country, pharmaceutical companies are making products that are safe for children in the US. They know how
yes,
to. They're not
yes,
bothering to make it that way for India. Nobody in India is checking. And worse still, there's something worse than that. We're exporting rubbish to what is called the
yes,
global south. Now,
yes,
here's this we have to address, Murti. Enough has been written about the fact that the African continent is used as a dumping ground by pharmaceutical companies across the world who do it with impunity. They don't care about the damage that they're doing. Is India now guilty of doing the same thing?
yes, of course. If you look at a lot of the smaller companies which are exporting, that's the bread and butter. So if you look at this very company, most of its income seems to be coming from exports. So it's not the big guys that are exporting to Gambia and all those countries. They may be doing a little bit, but it's a really small part of their world of what they make profits from and where they sell to. The smaller guys, thousands of them, are all over the rest of the world. They are cashing in on the reputation of Indian pharma, but actually ruining it by what they're doing there. And with a lot of these markets, Faye, they're very porous borders. So just because you've sent product into Gambia doesn't mean it remains in Gambia. Especially with cough syrup, drugs that are sold over the counter, they this then get pushed around to all the neighboring countries. So I hope it doesn't happen, but we could see this product popping up with neighboring countries around Gambia saying, "Hey, we found, a crate of this stuff next door." There aren't really checks to move this across. This one may be a little less, but we have lots of others, especially those that contain codeine, which are used by addicts as substance abuse. That has a black market that is all over Africa. So you import into a country, then it's taken over by the black market, and it goes all over Africa. Who knows how much more damage this can cause and others can cause. I fear it's caused more damage than we know because in a lot of these countries, there is not enough reporting of deaths and there is not enough investigation into the cause of the deaths. So many more could have died. We just don't know because nobody's looked for it.
Mm.
So it's the same in India. Babies die. Nobody actually goes around and checks why they died. You bury the little baby and then you get on with life. So that's been the problem that we just don't know how bad the problem is with this brand, with this company, with this supplier. So potentially this is, huge.
So what you're telling me, to what it is, just to wrap my head around it, is that there are products in the Indian market right now, which we
Yes,
are now giving to babies, we're giving to children,
yes,
we're giving to adults from nice branded, big listed companies. Nobody is checking what chemicals are in those products. Something might have leaked into one particular batch. Something might be deliberately done to actually reduce costs by one of the smaller manufacturers. The bigger guys actually bring it in, slap their labels on, and ship it out. Nobody is doing regular audits of the product in the bottle. Nobody's doing surprise checks. Nobody's visiting these factories. Nobody's visiting the smaller sheds that are manufacturing all over Uttarakhand and Haryana, and these states have now become really popular in manufacturing pharmaceuticals. So it's very popular. It's very possible that in our houses there are bottles of cough syrup that could potentially kill our children.
Not just cough syrup. I mean, any product that you're using, please take a look at the back of it. It will say, even if the brand is a big brand, it will say marketed by. And then you look further down in small print, it will say manufactured at. So you have to go that far down to understand whether it's manufactured at the company's
No,
own plant.
that information is useless because I don't know what to do with that information.
I'm just saying that even if you look at a brand, you will know many of them are contract manufactured. When you look down much further and say manufactured by in small words, it'll be somewhere. There is no way we can know any better. The only way is like us relying on a standard and saying the regulator said if you follow the standard, you have a license, and you've promised to follow the standard, therefore we're giving you a license. But you don't follow the standard, and we can't do anything about it. Would you buy, I don't know, a pressure cooker if it wasn't ISI marked? Would you buy, a car if it wasn't certified to be safe? You wouldn't buy anything. You wouldn't buy food substances if they don't have FSSAI. But FSSAI is just a certificate number. Tell me the last time for any of the packaged foods that you've had that somebody's actually gone and visited from the Food and Drug Regulator to say, hey, this is crap. You shouldn't be producing this. How many times have we seen, worms in food and things like that? Nothing happens. So those are the conditions in which
You
food
know,
is manufactured.
I'm not even crossing into the space of Ayurvedic and homeopathic
No, no, no,
medication because
no. We're not going there. But
we
that's
just can't at this point, right? We can't even, there's no point in even starting to talk about it because there are absolutely no checks and balances there at all. Is that accurate?
It is the same thing. So the Wild West that exists with homeopathy and Ayurveda is the exact same thing that happens here. So that can kill you as much as this can. The standards of actual manufacturing are exactly the same. It doesn't change. It's just a different label. And we found many of the Ayurvedic stuff contain all of this crazy stuff. It contains nickel, cadmium, lead, arsenic, a whole lot of this stuff which shouldn't be in anything. So the process looks virtually the same. It's still a pill, it's still a syrup, it's still a vial, it's still powder. The process for manufacturing is very much the same. So if you have very poor standards, it doesn't matter what you make, it's going to kill people.
So effectively, you're telling me that every time any Indian citizen takes any medication, Ayurvedic, homeopathic, allopathic medicine, or gives it to their children, you're effectively rolling the dice. You have no idea.
Yes,
There's no way to check.
no way to check. uh, you hope that the brand whichever you're buying has a conscience and they check, but there's no downside. If they don't check, nobody's going to jail if they don't check. So if that's the situation, who's going to check? If I'm sure I'm not going to jail, why do I care? And the only way you can figure it out is by asking executives of those pharmaceutical companies if they consume their own product. It's like asking the chef if they eat at their kitchen. So
Yeah, but that's such an easy white lie to tell.
yes, but that's why the only way it works in India is you ask your friends, right? You call up your friends at whichever company and say, listen, I'm going to buy this product. Would you give it to your child?
Listen, you are the only one who has friends in pharmaceutical companies. Who will I call? Who will, the people watching this show, who are they going to call? I don't want to have, you need new friends.
It's a very dangerous place, Faye. I think, I know we're laughing about it, but it's a really serious problem. It's really scary. Clearly, the politicians, the lawmakers don't care. The executive, the police, and the drug regulator doesn't care. So we're really, in the Lord's hands when we take any of these products, whether it's food or medicines. We really don't know what's in it. We've got examples where independent public health activists have gone off and done RTIs or actually taken samples and had it tested in a good lab. And it's scary. Some of the biggest brands that we know of sell crores every month, have absolutely scary stuff in them.
Yeah,
But
we've had someone on the channel called Onion Ginger Tomato who said, do we have to rely on the medicines that are exported to countries which have stricter regulations? I already asked that question. Murali's answer was that what pharmaceutical companies do is that they make a plant that is US FDA certified, which is very clean and very wonderful because that gets audited on a regular basis. But the stuff they make for us that they actually sell in the Indian market is made in a separate plant that is not US FDA certified because it doesn't need to be. So it doesn't need to have those high checks and balances, right? If you are not insisting on that level of quality, why would anybody? So what we need actually, really, our only option is to put pressure on our government to create a standards authority body that actually takes this job seriously and does regular checks and make sure that the factories are following these structures and actually randomly checks product as well to make sure that it's clean and it doesn't have things that give us cancer in cough syrup, doesn't have poison in your paracetamol. Because we've seen through COVID, if there's one thing we've learned is that our system desperately needs fixing. And it's nice that many of us have just been grateful that COVID is over and just moved on with our lives. But what we're going to wind up is in a hotter mess than we were before we started if we don't take the learnings from COVID and do something about it. Would be on that very grim note on my first show back. Thank you so much for joining us. But there's a lot of work to be done, and I'm glad we have people like you who are willing to sit up and talk about it because not enough is said about what's going on with the pharmaceutical industry. It was my pleasure to chat with you. Murali, thank you so much for joining us.
thank you, Faye.
For our audience, all 62 of you who've joined us this evening, thank you for joining in. We're going to start doing this on a regular basis. Leave us a note, like, share, subscribe, you know the drill. And if there's something specific you want us to discuss, we'd like to take that up for you. The idea here is to bring in domain experts and try and answer as many questions, understand what's going on in the news a little better. That's our aim. So drop us a note and tell us what you'd like us to talk about and share this channel with friends and family. Thank you for watching. Good night.